Good evening. I wanted to introduce myself first. My name's Dr. John Redd. I'm a captain in the United States Public Health Service, if you couldn't tell. And I've been spending a lot of time in California in the last weeks. I'm an internist and a medical epidemiologist, and I've spent most of my career with the federal government, with Centers for Disease Control and with Health and Human Services. My current job is I'm the Chief Medical Officer for the Assistant Secretary for Preparedness and Response, who's Dr. Robert Kadlik. And so in my role as Chief Medical Officer for ASPR, I've been deployed to several sites in California now, starting in January, in the end of January. So I've been to March Air Reserve Base down in Riverside, to Travis twice now, and to Miramar, and to Japan, and then most recently here to Oakland in the Bay Area to help with the response to the quarantine on the Princess. And it's been a real honor to work with so many different groups in the state of California and overseas with these responses, and we're extremely pleased to give you an update. So I wanted first to review what the numbers are nationally and in California for COVID-19 infection. In the United States, there are, as of now, 1,459 cases. That includes, unfortunately, 39 deaths. The state of California has been particularly affected with 198 cases and 4 deaths. Of the cases in California, 60 are travel-related, meaning people who acquired the infection elsewhere and then came here. 43 are from close contact, which refers to people who were in close contact generally with loved ones or household transmission. 44 have been community transmission, meaning where someone has picked it up in the general community, and 27 are still under investigation. And on board the Grand Princess, we've had 21 cases diagnosed so far. I wanted to go through briefly the procedures that we've been using on the ship itself and why it was necessary to have the ship quarantined in Oakland. Quarantine is something, a federal quarantine is quite rare, and you all are probably familiar with local quarantines, which are fairly common, generally things such as tuberculosis. Federal quarantines are much more rare. Most quarantine is actually a local or state or county function. And in this case, though, we've had federal quarantines on large numbers of persons who have been at risk for coming back with COVID-19 and for introducing it. And quarantine in and of itself represents many different conflicts. First of all, as American citizens, we're all, of course, used to freedom of motion and freedom of association and all those rights that we hold dear. Quarantine in and of itself is a fundamental limitation of those rights on a temporary basis in order to protect the community from transmissible conditions. So in general situations like this, including on the Grand Princess, there are some fundamental contradictions. We, of course, want the medical care for the persons on board to be as good as possible, and they need to be maintained safely. But we have a fundamental responsibility to minimize the risk of any transmission to the community, which is why we're doing the quarantine in the first place. So on board the ship, we have gradually been disembarking passengers. And we've done that very carefully. We're in constant contact with the ship's doctor, who helps us establish passengers who are reporting themselves as being ill. And we've got one gangway, you may have probably seen it on television, but we've got one gangway toward the bow of the ship, and that's generally where we bring down people who are reported as having been ill. And then farther toward the stern, we have a gangway for people who are reported as not being ill. As people emerge from the ship, we have a screening process to make sure that people are well. So people who come down from the healthy gangway are rescreened. We take their temperature and we speak to them briefly to make sure that they're well. And then we have a medical tent on the pier at the other end of the ship for people who are being reported as sick. So I give you those procedures because it leads into why we have a necessity for facilities such as has been established here. And I really want to say that you all are well ahead of things. I want to congratulate you on both your efforts that we've discussed tonight, and I think you're way out ahead of this, and I congratulate you for it. But the issues that come up during an event such as this are twofold, and this refers to the two types of people whom we wish to house at this facility. The first are people who are minimally symptomatic, but who are positive, as Eric mentioned, who are positive for the COVID-19 test. Those people, many of whom I've literally seen, can be very, very minimally affected. Some fortunate people, it's very much like a sort of a deep chest common cold. However, they're positive, and people in the case of this federal quarantine are maintained on military bases, on which, as Eric mentioned, we can't maintain people who are positive because of DoD policies on force protection. So one group of people are those who are minimally affected but positive. Then the other group of people, and those folks get well, and that there are people there now who, if you were just to see them, look perfectly fine, but they've had a positive test. They need to stay there. The second group of people, besides those who are either minimally or unaffected but positive, are people who go there and are minimally affected and need a test, and we're going to have provision of being able to do swab tests there. And the key feature in both of those are that both of those categories of people are people whom we would not like to have in local hospitals. That's really the key function. And but on the other hand, people in this federal quarantine, in effect, have no home to go to. So it's a complicated issue, but this seems to be the best way to keep people safe, make sure that they do well and recover from their illness while maintaining that the community doesn't get affected. So I did want to talk about some of the precautions that we use on the facility. So it's designed to house people from the Grand Princess who don't need hospitalization, but who cannot be maintained in quarantine. So those are the two categories of people I've just mentioned. We have taken great caution to maintain the safety of both the guests there and for staff, all of whom are federal. The entire facility is maintained with CDC standard precautions for infection control, including personal protective equipment, which would be familiar actually to any clinicians in the room. The usual, if you're seeing a patient, the usual, which means close and doing any close procedures, it's gown, face shield, mask, and gloves. And we've got lots of PPE. They got a very large shipment there today, so the facility is well prepared to take people. And the guests there, though, are under federal quarantine orders, and they need to be maintained there for 14 days. We have booked it for a longer time in case that's necessary, but on an individual basis, people who have been evacuated from the ship need to be in a total time of quarantine of 14 days. And Eric, was there anything else that I should mention at the moment? Okay, so thank you very much. I'd be very, very happy to take questions. Thank you.